Hi, this is Dr. Ben Hopsiger with Chronic Care of Richmond. Today we're talking about peripheral neuropathy, and the nature of what it is, what we do when it comes to treating it. Peripheral neuropathy is mostly classified as the damage associated with the nerves that are going to be in your hands and your feet. Specifically, this would be a type of neuropathy called small fiber neuropathy. That means the damage is happening at the far ends of the nerves. In that circumstance, it's going to show up first. Hands and feet are where you're going to feel those symptoms. There are a lot of different potential causes associated with small fiber neuropathy. There's a common thematic element in that chronic inflammatory damage is present in the vast majority of the causes of that, whether that's autoimmune related damage, whether that's diabetic neuropathy, whether that's alcohol-induced neuropathy, chemotherapy-induced neuropathy. The damage is happening at the far end of the extremities because that's where the smallest blood vessels are. The small blood vessels, called capillaries, are very fragile. And when we create an environment of chronic inflammatory damage in your body, when those blood vessels gets damaged, sometimes the nerve also struggles pretty tremendously. The most common version of this by far is diabetes, where you have uncontrolled blood sugar that's leading to damage both directly to the nerve and very indirectly, but also leading to the problem, damaging the peripheral blood flow that is responsible for keeping that nerve healthy. At Chronic Care of Richmond, our objective is to treat both the health and well-being of the nerve and stimulate the nerve to get healthier and stronger. We also want to support the healthy blood vessels by helping to reduce the sources of chronic inflammation and directly encourage their rebuilding. For both of those goals, we utilize a regenerative medicine procedure called platelet-rich plasma therapy, PRP, which is very useful to help encourage those small fibers to rebuild and be in an environment where the blood vessels are going to be healthier and stronger. We also work on home protocols to help people get healthy and be able to continue to stimulate the rebuilding of that nerve tissue, both with exercises and home modalities. And we offer advanced in-office modalities that will, again, support the rebuilding of those blood vessels and those nerves. If you have additional questions about the nature of who we are and what we do and whether or not what we can do can support you, I do definitely recommend, if you ever have an opportunity, please attend one of our seminars that we regularly hold. We talk about peripheral neuropathy and how we work. If you already have a diagnosis of peripheral neuropathy and you're ready to make changes in your health and start getting this moving in the right direction, I definitely recommend please contact us at our office and schedule that new patient appointment. I'm looking forward to helping you.